probably wasn't until I actually was in my room and left alone. You know, you just look in the mirror and you just kind of go, I have cancer, I have leukemia. You need to be your own self-advocate. You need to stick up for yourself. It's important to understand what's going on in your body. It may be scary, but I truly believe that not knowing is probably scarier.
And then Michele, you also just got done talking about why you switched doctors and sort of the self-advocacy. So thank you so much for that. Now we're shifting into the second segment, really focused on the treatment. And you've undergone 2 different TKIs. And so let's start off by talking about the options you were presented the first time around with 3 different TKIs.
Okay, so I was still in the hospital and I was getting close to the 100,000 white cells, which meant I could be going home shortly. And my doctor actually came and told me that I would be leaving and I would be on a medication. This is pretty much what he said, is you will be on a pill for the rest of your life. It's a very small pill, but it costs a lot of money. I'm like, oh, okay. I said, and what's the name of that pill? And he told me Gleevec. And I'm like, Gleevec. I said, well, is it the only option for CML? And he said, well, no, there's 3, but this is the one that people usually start with. And I said, well, could you tell me what all 3 of them are, please? And he told me and rattled off the names and I didn't understand. So I'm like, write them down. And so he wrote them down. And I think at this point he was a little exasperated and kind of maybe a little bit annoyed that I was questioning him, and I didn't really care. And so I wrote them down and I looked them all up that night. And what I found was Gleevec was the first TKI. It was invented, for lack of a better word, by Dr. Drucker. It saved so many lives. It was great in that regard. They came out with the second one. I'm like, oh, they came out with the second one, so maybe better. So I started researching that one, that's called Tasigna. I found that you had to fast an hour before, 2 hours after, twice a day. Okay, that alone, I was like, well, that probably won't work for me. And it also had a black box warning. And when I looked that up, it was cardiac issues. And I take black box warnings on medications, extremely serious. So I kind of scratched that off. And then Sprycel was the third one. And the data on it seemed to say that people reach the milestones that they expect you to reach for CML for the best long-term outcome quicker than on Tasigna or Gleevec. So for me, I'm like, oh, why wouldn't I want to start there? So I told him back at it. So Sprycel seemed to have better data regarding reaching milestones and long-term success, I guess, for lack of a better word. So that's the one that I wanted to start on. So when my doctor came in the morning, I told him that, and he said that people usually started with Gleevec. And I said, well, you said usually, so what do we need to do? I want to start on this one. And he sent in his assistant and she got a 7-day free trial at the pharmacy. They got me on the patient assistance program and I started on Sprycel. It was once a day. Typically start at 140 milligrams. I guess 100 is fairly normal also. I questioned the dosage based on my thinking, which was, why would I at 110 pounds take the same medication that somebody that's 300 pounds? And shouldn't it be geared more towards body size as opposed to just this is what you do? So I was opting for a lower dosage to see if it would work because of the longevity of having to be on a medication that could potentially damage the rest of my body. So I think we agreed on 100 milligrams, and that's what I started on. So I continued, and I'm telling you, taking that first pill, I took it when I got home to LA, and you read all of the possible side effects and things that could happen and adverse reactions, and it's just scary. I literally looked at that pill and I'm like, oh man, what do I do? Okay, over the lips. And I took it and I just sat there waiting, not to call 911 in case something horrible happened, which it did not. Gave me a terrible headache. Felt like I had the flu. I had to go to bed. It took me weeks and weeks to adjust to it. And part of that, it's like, is this the pills? Is this still just the leukemia? You just don't know in the beginning. You just don't know. So I just had to say to myself, you have cancer, you have leukemia, you are sick, be kind to yourself, rest when you need to rest, and do whatever it is you need to do your your weekly blood draws, take your medication. Which what ended up happening, and often happens in the beginning, is that it will absolutely tank your white cells. And your white cells are what fight infection. So here I went from 385,000 to 900. And I couldn't figure out why I felt so sick. Well, I felt so sick because I had 900 white cells. So they called me once again and they're like, come to the emergency room. And they gave me a shot of Neupogen, which stimulates the growth of white blood cells, which also causes more bone pain that you already have and all of those other things. So I had to have several injections of those to get it stabilized. And then they hung probably at about 3,000 for probably 3 years. They're currently around 5, so that's good. I was fortunate. I did not get other illnesses. I didn't get sick. Of course, I didn't go anywhere. So I wasn't really exposed to germs. But all in all, I am a pretty healthy cancer patient. So I'm fortunate for that. The other thing I did want to say is that I feel like it's really important if you have CML to see a CML specialist. And meaning, what I mean by that is somebody who sees more than just you. You want somebody who sees lots of CML patients so they can say, okay, this happened to this person. This is common. I see their white cells dropping below 4,000, and this is what I did, and this is the result I had. So you want somebody who has knowledge and experience with things like that, so they know what to do, and they're not just going to the internet. I can do that, and then you tell them what to do. But you want somebody with actual true experience.
You had mentioned side effects. So in the beginning, it had been headaches. Did they go away on their own?
Okay, so in the beginning, Sprycel clearly gave me headaches, which I took Tylenol. They felt that was the most compatible with the Sprycel, as Sprycel can also cause your blood to become thinner, which ibuprofen can even make that happen even more so. So Tylenol was the drug of choice for headaches. I had terrible bone pain. I had pain in my hands. Everything I picked up, I dropped. They would burn at night.
Was this neuropathy or something different?
It was. They ended up saying it was neuropathy. They kept saying it wasn't from leukemia. It wasn't from the Sprycel, and I kept saying it absolutely has to be. I don't believe that it's anything else. They sent me to a neurologist. They did all the tests. All the tests were negative. They were absolutely convinced I had carpal tunnel. I did not. So they finally agreed that it was the Sprycel. I would use Voltaren gel. I would try that at night for inflammation. That didn't really help. I tried those compression drugs. That didn't really help. I did try the Claritin for bone pain. That helped somewhat. Back, muscle spasm, musculoskeletal pain. I used heating pads. I used Voltaren gel. I used ice. There were some times that I was literally down 2 or 3 months that I just couldn't get up. Everything hurt so bad. And talk about boredom. I mean, you just get sick of your own self. You know, you really couldn't watch TV because you couldn't focus. You couldn't read a book because you couldn't focus. And here you are with yourself on the couch. What do? So I ended up teaching myself to crochet all these cute little animals for my grandkids, which aggravated my hands. It was like just no win, no win. And then the feet, the neuropathy in the feet where I could hardly walk. And that went on probably for the better part of, I don't know, 3 years, probably off and on.
3 years?
Yeah, it drastically changed my life. I mean, I really just, everything that I used to do, there was nothing that I could just say, "Ooh, next Tuesday, let's go to a movie." Never. I mean, maybe I could go, maybe I couldn't. They stopped inviting me because half the time I had to say, no, I couldn't go. I did not know from moment to moment.
I really want to dive in here because I think, people talk about two sort of things in considering different treatments and trials and drugs. And that's, of course, efficacy, like, is this going to extend my life and survival? But there's also the quality of life, which I don't think people understand just how much that weighs. Because sure, it's great to have extended life or survive, but what does it mean to be living if you are dealing with these debilitating side effects that keep you in bed, that keep you isolated, impact your mental health? I'm sure.
It's true. You just, with CML, because it's forever, you just hope that eventually it will level out and your body will adjust and you will get to a better place. And what I learned is, and it was through trial and error, I started writing down my symptoms daily. And what I found was that my side effects correlated 100% with the lot number of drug that I took. And different bottles, every 30 days, I felt different side effects. And what I learned over time was, man, if you got a good bottle, it was a great month and I could do more things. And I got to the point where I actually had, because my drugs came from mail order, they had to come from a specialty oncology pharmacy. And I would ask the person filling my order, could you look for this lot number when I got a good one? And I had one person who would do it. And it was the best 6 months of my life during that time. I was like, for 6 months, I felt great. And then I got a crappy bottle and, back down. So it got to where you just didn't know. So, but yet I held out hope that eventually either they would come up with a better drug or maybe a cure, or who knows, you just learn to live it. They call it a new normal. It's just a new normal. And it's hard because I was always fly by the seat of my pants, did whatever I wanted, whenever I wanted. I never, ever considered I might not feel good enough to do that. Never entered my consciousness that I would have to live with, how do I feel today and can I do it? And I'm going to suffer if I do it. Like I would go dancing on occasion when I felt good. I was wiped out for 2 days, but it was worth it. Yeah, you have to kind of go,
I like that. You made trade-offs. You said, okay, I might not be down. I might be down for the count for a couple of days after, but it's worth it to go out for these couple of hours.
Yeah.
So just making those decisions was part of getting through these tough times. Was there anything else that you found helpful to get you through, not just physically, but just the mental and emotional strain?
Well, for me, I actually, I may have mentioned before, I started writing a blog. It was not for anything that it was simply to, at the time, keep my friends and family informed. As I learned about CML and what that meant and what my treatments were and what I was doing, I put it on a blog because, as you know, when you get sick, people start calling and it's exhausting. And my poor husband had to field all the calls because I didn't have the energy or the emotional stability to keep saying, it was so hard. I told my children it was the hardest thing I've ever done. So cancer, see, train of thought, gone. That's also happens. That's really good.
All the time for me too. Yeah.
All the time. I totally forgot what I was saying. Oh, so I started writing this blog because it would, as I learned, I wrote it down. My friends and family could read it and they could understand what I was going through and how I was feeling at the time. So that was really, really helpful. Well, what I found was back then, there weren't so many Facebook groups and this and that and all these other things. There was not very little on the web about CML at the time, because like I said, people died, people got diagnosed older, they weren't on the computer, all of those things. So I started hearing from people all around the world and saying how helpful it was. So my bad days, I wrote about my bad days. On my good days, I wrote about my good days. And I just started sharing what living with CML was like. So that gave me an outlet, and people reaching out who didn't have access to good care or were afraid to stand up for themselves and that sort of thing. It helped me to help them. I never would have dreamed my life would have become an open book ever in a million years. I just, if anybody wants to know anything about me, just go read my blog because it's all there, the good, the bad, and the ugly, all of it. So that changed. I just, like I said, I started crocheting little things for the kids to keep my hands busy, just to keep my mind focused, just to learn something new. I started watercolor. I mean, just different things than what I used to do, just different ways to fill the time and the space that didn't take a lot of energy.
Yeah. So you were very focused. You kept your mind right by being active and being very focused. And, as we're talking about side effects now, I think, well, before we go too far, I know you said you started to have a little bit of hair loss. That might've been from the cytarabine, but you never really...
It was and the Sprycel, my hair was just falling out in buckets. I mean, it is so thin right now, even still, I barely have that much hair on my head. And the other very interesting thing with Sprycel is all of a sudden I looked and my hair was completely white. I had dark hair like you, and this white line. And I'm like, oh my gosh, what the heck? And my skin was extremely white as well. And I went to my oncologist and I'm like, what's up with this? And he's like, it's the Sprycel. It takes the color out of your skin and your hair. And I'm like, oh my God. And I'm like, can I dye my hair? And he's like, well, you already have cancer. There's a bunch of chemicals. I guess you could if you wanted to. And I'm like, oh man. Oh. So I thought about that and I just let it grow out. So my hair just grew out. That's ridiculous. I didn't care. I had cancer. Who cares? All of a sudden you really just don't care. So my hair grew out. My skin was white. Another thing that happened, we were in Europe and there was a transportation strike in Rome and we walked miles to get back to where we were staying. And when I looked down, my legs were like hamburger. All of the blood vessels in my legs, bright red, just splotchy red. I was mortified. I took pictures. I sent an email to my oncologist and I'm like, do I need to come home? And he's like, no, just try and stay off them for the next couple of days. They should be okay. If it gets like that again, just try and stay off of them. So we were getting on a cruise. So I was in a wheelchair for like 4 days. They got better, walked around. They were fine, happened again. And interestingly enough, I had 3 people come up to me and ask me if I had cancer. And I was like, yeah, why did you ask me that? And they're like, your legs. My husband has cancer and his legs are doing the same thing. So apparently, I don't know, the heat. It was the heat. I couldn't be in the heat at all on Sprycel. I couldn't be in the heat. I couldn't be in the sun. But apparently all the capillaries would burst close to the skin from walking. So that was fun.
Another
And being out of the
surprise.
sun and the heat, they called it Nana's rag. It was a chili pad. Those things are like so fabulous. You wet them and put them around your neck and they stay cool for hours. Now I've got a little fan, like a personal fan that goes around my neck because I'm very heat sensitive now. I'm not as bad on the Bosulif as I was on the Sprycel. That and probably the most dangerous side effect was the pleural effusion, which is where the sac around your lung fills with fluid. And the first time I had it drained, they took 2 liters, which, if you know what a liter of soda is, that big bottle, 2 liters out of my lung. I walked out of there, I'm like, oh my God, I can breathe. Who knew, right?
So you knew with the pleural effusion, it was trouble breathing. You felt.
I didn't really at first. I kind of had a cough and it was just annoying.
What kind of cough? Like a dry, was it
Not like
a
a dry cough,
Mhm.
dry cough. And it did seem like if I tried to take a really deep breath, I just couldn't quite get a deep breath. And for the first year or so, it was controlled by, I would go on Sprycel breaks. And my doctor approved. He's like, let's take you off for a week or 10 days until the pleural effusion begins to clear, and then we'll try you on a lower dose. I was on so many doses of Sprycel. And here's a very interesting thing. The very first time I was off of Sprycel for 10 days, on the 3rd day, and it's going to make me teary, I was like, oh my gosh, I felt like me for the first time. It was like this little spark. And my husband comes home from work and he's like, what's up with you? And I'm like, I don't know. I was literally giddy. I was happy. I'm not that I'm a sad person, not that I'm a depressed person, not that I'm a pessimistic person. I didn't think any of those things, but this little spark of joy, I didn't even realize I was missing it. And it wasn't until I went back on the Sprycel, I called it Sprycel sadness. It was like a dark cloud. It was like it just dampened who I was. So I know a lot of people, if you don't have the opportunity to go off and back on, they may not. I never realized it. I didn't know. I didn't know that it made me feel duller, but it absolutely did. And that kind of sucked. You know? I'm like, oh man. So those Sprycel breaks were pretty great.
Michele, I just, before we move on, you even pointed out, you said, I'm going to get teary eyed. What is that emotion for people who don't understand, sort of this like epiphany of, oh, that's me. That's Michele.
Yeah, it's just it's hard to explain. I mean, if you haven't been there, I mean, it's just a little tiny spark that's missing. So it takes something away that you didn't even know you were missing until you have an opportunity to revisit it. And it's not like I sit around and mope and woe is me and I have cancer and I'm going to cancer the rest of my life. And, I just, every day I try to live my life to the best of my ability every day, because that's why I take the medication, because I love life. I love my life. I'm fortunate. I'm blessed. I'm in tremendously better shape than so many other people. And I'm grateful. But there's a tiny little spark that's just missing. And I can't even explain it. I don't know, but it makes you, if you think about it, it can make you a lot sadder than, just a momentary moment of of teary. It just makes me teary. I could just, so it's just something that I, miss within myself that, you wouldn't know if you didn't know.
Right.
Nobody around me would know.
Right. Well, I appreciate, again, you sharing that, because I know it's a lot of vulnerability. As we now shift into the pleural effusion, so you were coughing, it was dry coughs, something was wrong. You did talk about needing to have procedures done to help take the fluid out that happened. At what point did your doctor, or was it you or your doctor who then said, I don't know if this can go on any longer?
My doctor probably told me that for a year. And for a year, I'm like, no, I'm good. I'll just get it drained every couple of months and I'm good. Because what I learned is that when you get comfortable with something, and at that point, I felt pretty good otherwise, or so I thought. I had adjusted the hand stuff was sporadic. The headaches had kind of gone away. I felt like I had more energy than I had in the beginning and all of those things. So I felt like I had adjusted pretty well to Sprycel, and it was keeping my leukemia at bay. It wasn't the greatest PCR results, but it was good. And my doctor had said that it was good enough that he thought that long-term, my prognosis was good long-term. So I was like comfortable with it. And I understood Sprycel. I knew Sprycel. I didn't want to switch because if I switched, I had to make a choice between Tasigna and Gleevec, and neither one of those sounded better than what I was already on. And plus, if I gave up on that one, then I'd only have two more choices if I really got in trouble and my leukemia became out of control. Because what people don't understand is that every 3 months, you do have to be tested because it can become uncontrollable at any point in time. So I kept sticking with it. I mean, I even went to a pulmonologist and they said there's a procedure that they do that they can put powder between your lung and the pleural sac, and it causes like a scarring, and it causes the sac to stick to the lung, which then the pleural effusion can't happen anymore. But then my thought went to, well, if the fluid doesn't go there, where does it go? You have a sac around your heart. Oh, great. If I have to get, pleural effusion, I don't want it around my heart. So this went on and on and on. And I just started getting my lung drained on a fairly regular basis. And I'm like, can they just put it in a drain and I can just drain it out every day? I mean, I'm good with that. And they're like, well, that is an option if this continues. Fast forward another year, and I had to have rotator cuff surgery. And I had to have it drained the day before surgery. They checked me with a x-ray right before surgery. They had to drain it again that morning. And what was supposed to be an outpatient surgery, they were already going to keep me overnight because of the CML. Ended up a week in the hospital on oxygen, going home on oxygen for several months. So I was like, okay, I think now's the time to make a choice and to change. And at that time, now Bosulif was an option. Bosulif's biggest side effect for people seems to be massive diarrhea. I travel. I like to go places. I like to fly. I'm like, I can't have that. I don't want to be homebound constantly. So I'm like, okay, I'll try it. Bosulif is known for that and nausea. So we pre-medicated with Zofran, and my oncologist, being a CML specialist, said start on 100 milligrams, 400 milligrams, the desired dose. Start on 100 milligrams for a week. If you tolerate that well, go up to 200 milligrams. Give your body time to adjust. This drug is one of the hardest to start. It's rough. It is difficult. By the time I got to 300 milligrams, couldn't tolerate it. The nausea was so bad. I asked, can I split it to 200 and 200? Yes. All doctors that aren't CML specialists will say no. They will give you a 500 milligram pill, start you out on that, and can't figure out why people fail the drug. It's because they're setting them up for failure. Anyway, between the Zofran, the Preggy Pops, I use those. My friend sent me those off of Amazon. They're little, like, I don't know, sucker things. They're called Preggy Pops. They use them for pregnant women. I did the pressure things for the motion sickness. The Zofran, what I found that works the best for me, CBD drops. No THC, just CBD drops. I start getting nauseous, 3 drops under my tongue. I roll my eyes and go, there's no way this is going to work. Works every time. crazy. I cannot believe another cancer patient gave me her drops when she finished her chemotherapy. I'm like, I'll try anything. So for me, it wasn't the diarrhea, which was a good thing, or occasionally it was the nausea. I have way more energy on Bosulav once I adjusted. I can go out in the sun. My hair's getting a little darker. It's not as white. I have a little color in my skin. So all of those things are good.
Wow. So you responded well to the Bosulav or bosutinib, which had been approved in December of 2017. When did you make the switch again? It was about that time?
I don't remember. It was probably about that time, 2018, maybe end of 2017. And I know at one point it had to be a second, your second TKI. And I don't know if they will yet start people on it. I think they might, but I'm not sure about that. But it was at the end of 2017, I believe. And my oncologist had 5 other patients who were on it and doing really well.
Oh, quick question. Were you pH positive?
Yes.
Okay.
Yes.
Okay.
Yes.
Bosulav had not been one of the first ones option because it wasn't a first line treatment.
And back in 2000, was it 10 or 11? It wasn't even, I think it was still in trial.
So, but you had qualified for it right when it was first approved because it was for previously treated pH positive CML. Okay. So great. So, and now in December of 2017, thankfully for any newly diagnosed, there's more options, which is great.
Yes. And there's another new one, actually, a synonym, something like that.
So I think, Michele, what this is all pointing to is that, there's obviously a lot of importance on the research part of things, just not that we're coming up with any little thing. They should be much more effective than what's already standard of care. But that without clinical trials and all this research going on, patients wouldn't have more options. And you had mentioned earlier in our conversation about not wanting to go to Gleevec or is it Tasigna, just because you wanted to preserve options because, it's top of mind for you, right? If this isn't going to work anymore, how many more options do I have? So can you speak to just what your thoughts are as someone who has a chronic cancer on that importance?
It's a little hard. I think for one, you get comfortable with what you're taking. And two, you have these options. They're kind of like an ace in the hole, well, if this stops working, because there's always a chance that it might stop working altogether, which at that point you have to go to another option. Fortunately for CML, they seem to keep researching and coming up with new options. They also have another one called ponatinib for people that have a mutation in their CML. So there are more options. They're also coming up with things where they're trying treatment-free people. So it's all of these things. You have to take all of these things into consideration when you're choosing, what is best for me at this moment, at this point in time. And it is helpful to talk to other people. I have a Facebook group, I have my blog, I hear from other people and hear what their experiences are. Some are helpful, some are just downright terrifying. CML seems to be, people think, oh, you have CML, you'll be fine. Unfortunately, that's not always the case. I've lost many people that I've met over the years with CML who have gone into blast crisis, who have had bone marrow transplants, who have had second bone marrow transplants, and they don't live. So while it may seem, and a lot of people do get diagnosed routine blood work, say they're going for a new job and they want to have a physical for whatever reason, they get diagnosed very early. They get treated very early. Their CML is non-detectable within 6 months. It's great, but there's plenty of people like me who don't. And, for me, they pretty much said it's never going to be an option for me to be treatment-free, probably because I explained away all my symptoms in the beginning. And I was, diagnosed further into the disease than many other people.
Michele, you mentioned now, so thankfully Bosulif has been effective for you. You said you feel also more energized. So that's great. And you also do every 3 months still a checkup with you have multiple doctors actually. You're working with 2 different ones. Why? If you could summarize, you don't have to go into the details, but just why working with 2 doctors first?
Okay. So I was happy with my doctor in Los Angeles, and my husband retired and we moved to Boise, Idaho. And when we were in Boise, we went to a dance event in Portland, Oregon. Well, Portland, Oregon happens to be where Dr. Drucker, who developed Gleevec, practices medicine. So I'm like, well, why wouldn't I go see him? Because he is like the grand poobah of CML. So I made an appointment with him and loved him as well. So I would see him once or twice a year, and then I'd see my doctor in Southern California once or twice a year. And
you would fly or do virtual?
I fly. Well, I fly once and do virtual once usually, but it works out for me because I do have family there, so I just use it as an excuse to go. Unfortunately, I'm retired and I can. But I also feel like, you know what, if you need to fly and see a specialist, even nowadays, specialists will see you, they will establish you as a patient, and they will work with your local oncologist. It's so worth it. It is just, I just want every single person who has CML to see a specialist, and it doesn't happen. And those are the people that seem to not do well and actually have passed away. But so I see Dr. Drucker, he sends me a blood kit. I have it drawn here. They ship it back to Portland, and then I'll do a virtual doctor's appointment with him. What was
No, and that's wonderful. And so then having to see your doctors or follow up with one of your doctors every 3 months at least to check in, because as you alluded to earlier, it's just part of making sure that everything's under control.
Yes.
You've been doing this now for over a decade. So what's your guidance to other people where it's, it's daunting? We talk about scanxiety. Well, the anxiety applies to so many different things. Like, how has anything helped you adjust to sort of not normalize it, but to better get through it?
Honestly, I don't think it necessarily ever gets easier. I do somewhere along the line, probably 5, 6, 7 years in, there came a time where I didn't think about it every single day. Like, oh, you have cancer. And then the other problem with having cancer for the rest of your life, every ache and pain, you're like, uh-oh, what's that? Uh-oh, what's that? Oh, I hope that's nothing. And so that is not great. That's not so much fun, especially in the middle of the night. And I'll say to my husband, if I die tonight, it's probably a brain tumor and it's right here because it hurts right here. Or I say, I got this over here. It's probably that. So just so people know. It puts you on edge, and you just, and my logical self says, stop it. But my brain is like, it's that little guy sitting on your shoulder. And so, but there are days where I go through a whole day and I don't remember that I have cancer. And then I know I have to get blood work. And the last blood draw I had, which is now 4 months, because the blood was compromised in transit and I have to redo it. But it was the best one I had in like 2 years. It was so exciting. And I'm telling you, every time I see test result in my chart, I'm like, ugh. I go, I get my blood drawn. We do a happy dance over it. We do good juju, and then they send it off. And I have to wait a week or two. And then I see the test result pop up, and then I want to look, but I don't want to look. And sometimes I look and it's gone up, and I'm like, oh, okay, it's only gone up a little, and then you got to stress for the next 3 months. Is it going to go up, stay the same, or go down? And then I had a great one. I'm telling you, I was dancing. I was like, I was so excited. It was just like the best. And so I put off getting my next 3-month for like 3 weeks because I'm like, I just want to live on that really good one for just a little longer. So I finally do it 3 weeks late, gets compromised in the mail. I have to redo it. So I'm still waiting for that result. But I don't know that it ever really gets easier. You just don't know. Unfortunately, it's but
yeah,
nobody knows. Nobody knows,
right?
Right?
Right.
You know?
Right. Nobody knows. Yeah. None of us knows. Yeah.
No.
And what you've chosen to do, I still have heard it throughout the conversation, is you've chose to focus on, what you can do and being, leaning into what you love, dancing, crocheting, spending time with your family. Michele, I so appreciate you spending all this time with us, sharing so much of your story. Is there anything you wanted to add for our viewers?
I don't know. I guess the one thing that I've learned more than anything is that you need to be your own self-advocate. You need to stick up for yourself. It's important to understand what's going on in your body. It may be scary, but I truly believe that not knowing is probably scarier. If you're in the hospital, have an advocate with you. You're too sick even to stand up for yourself. I feel like every single person that's in the hospital that's going through anything needs somebody there standing by their side and trying to do what's best for you. And don't be afraid to stand up for yourself. Learn about your diagnosis, learn what your options are, and fight for you. Fight for you. You know you better than anybody else ever will. And you just, need to do that. It'll make you feel good and it'll help your illness.